Welcome to the program. Thank you so much for joining us here on Health Professional Radio. Glad that you're here. Our guest is returning to speak with us, Mr. Jon Michaeli. He's of Medisafe. Medisafe is the leading medication management platform used by almost 4 million people worldwide. They've just announced that their feature to alert users of possible dangerous or malfunctioning drug-to-drug interactions is now available on Android, in addition to the existing platform. Welcome back to the program. Jon, how are you?
I'm great. Thank you very much, Neal.
When we were here before talking about dangerous drug interactions, most of our listeners, being healthcare professionals in some capacity or another, are familiar with drug interactions. But tell us how important it is to be familiar and understand how drugs interact with each other.
Yeah, absolutely. Well, first of all, there are drug interactions. There are also interactions between medications and other what we call lifestyle interactions like food, alcohol, etc. Right? So, but the more medications you take, the greater chance there is that there's an interaction. And in the United States alone, medication errors are estimated somewhere between 50 and 100,000 deaths in that order. And then about 7,000 deaths occur from adverse drug reactions. So that's really important for starters. But then what is less well known, but we're starting to understand, is when people take these medications together and they don't feel well or they have some reaction, they stop taking their medications, which is counterproductive because when they stop taking the medications, they're not adequately or correctly treating the conditions that they're trying to manage. So there is a less quantifiable, at least to date, impact of this drug interaction problem.
What about in the workplace? You've got people there in most offices. They've got a first aid kit or somebody there who's at least counts as that person who you can go to if you cut yourself or sprain your ankle or something like that. Are these people, say at work or at school, are they as versed in drug interactions as they need to be, based on your experience?
Well, there are, I don't know the exact number, but thousands and thousands of interactions ranging from very mild to very severe. And so I would say that even the most educated healthcare professional may not be familiar with many of the potential interactions, perhaps some of the most common ones, and of course some of the most severe ones. But again, outside of being rushed to the hospital, there's also the potential for people to just not get the care, the treatment that they're expecting. And so, yes, we have access in Medisafe to databases that have a catalog of all of the interactions, known interactions that exist from mild to severe, with the appropriate notification to the patient. And together with our recent expansion from iOS, which we previously supported Android, we also launched on both platforms an interaction checker. And that interaction checker enables a patient or a provider, if they want to access via Medisafe, to type in two medications to see if there's interaction between them. So, and then to give more color, more information around that.
Now, just to put it into perspective, before Medisafe's platform, how inefficient was it to pinpoint some of these drug interactions and give the care that you were talking about, give that adequate care efficiently? What was the process before your platform?
Well, remember that, when you talk about the platform has patient users and it has professionals, healthcare professional users. The app, which is what patients download, primarily the less educated, again, patient or user of Medisafe who wouldn't know about these in advance. And because Medisafe allows you to add any medication, irrespective of where you fill it, what pharmacy, what doctor prescribed it, etc., essentially what we're doing is enabling people to bring in all of the medications in one place and then inform them of any potential interactions, which their pharmacist, even educated, wouldn't have known about because they're only filling a portion of their medications. So they don't know the interactions because they don't know other medications that they're taking. Medisafe is in a unique position as the aggregation point, where patients are inputting from multiple locations or adding manually all of their meds. And just to give you some numbers, 50% of Medisafe users have more than 3 meds, 15% have more than 10. So these people are in a unique position like never before to have access to this information that wasn't previously available, and certainly not aggregated in this fashion.
Now, this information is added by patients, as you say, putting in their drug interactions on a daily basis, or however often they're referring to the app. How often is the app updated with, just automatically based on information in the medical world coming from journals and publications or television shows? I don't know. How often does it update just on its own with brand new information about drug interactions?
Minimum of once a week. And we are using databases from Elsevier, gold standard. So it's really best of breed database that is on their end being updated even more frequently, but on our end is the minimum of one.
Is it just as effective when it's gauging drug interactions with, say, supplements that are non-pharmaceutical?
It's a very good question. I know we deal with these lifestyle interactions that I was talking about, where you're looking at food and beverages and alcohol and so forth. OTC, I'm not entirely sure, but we can get back to you on that.
Now, where can we get some more information about your company, Medisafe, and all of your features?
Sure. So you can go to medisafe.com and learn more about the company and our products, but also you can go to the iTunes or Apple App Store or Google Play for Android and download Medisafe directly.
Thanks for coming back, Jon. It's been a pleasure as always. I'm hoping you'll come back and keep us updated as to what's happening there at Medisafe.
Absolutely. Great. Thank you for inviting me, and look forward to coming back and sharing more.
Great. Jon Michaeli, EVP Marketing and Business Development for Medisafe. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page when you visit us at hpr.fm and healthprofessionalradio.com.au.